The body is made up of the head, trunk and limbs. The trunk consists of the neck, thorax, chest, and abdomen, belly. The lower part of the abdomen is the pelvis. This word is also used for the bones of the pelvis. The lowest part of the pelvis, or in other words the lowest part of the trunk, is the perineum. The central axis of the trunk is the vertebral column, and the upper part of it, cervical part, supports the head. The main parts of the upper limb are the arm, forearm and hand. Arm in strict anatomical term means the upper arm, the part between the shoulder and elbow. However, this word is commonly used for the whole of the upper limb. The main parts of the lower limb are the thigh, leg and foot. Here also leg in strict anatomical form means the lower leg, the part between the knee and foot, but the word is commonly used for whole of the lower limb. In order to describe the positions of structure and human anatomy, the body is assumed to be standing upright with the feet together and the head and eyes looking to the front, with the arms straight by the side and the palms of the hands facing forwards. This is the anatomical position, and structures are always described relative to one another using this as the standard position. This is also applicable even when the body is lying on the back to bed or when lying on a dissecting table. The median plane is an imaginary vertical longitudinal line through the middle of the body from front to back, dividing the body into right and left halves. The sagittal plane is any plane that is parallel to the median plane. The adjective medial means nearer to the median plane, and lateral means farther from it. Thus we can say in anatomical position, the little finger is on the medial side of the hand and the thumb is on the lateral side. Similarly, the great toe is on the medial side of the foot and the little toe on the lateral side. If we consider forearm, which has two bones with radius bone on the lateral side and ulna bone on the medial side, then the adjective radial and ulnar can be used instead of lateral and medial. Similarly, in the lower leg, where there are two bones, the fibula on the lateral side and the tibia on the medial side, the alternative adjectives fibular and tibial can be used. Coronal planes are imaginary planes at right angles to the median plane. Horizontal or transverse planes are at right angles to both the median and coronal planes. The terms anterior and posterior are used to indicate the front or back of the body respectively. Therefore we have anterior and posterior view of the body or any part of body or organ. It is also used to describe the relationship of two parts. One is said to be anterior or posterior to the other if it is closer to anterior or posterior to the body surface. Hence on the face, the nose is anterior to the ears and the ears are posterior to the nose. Sometimes ventral is used instead of posterior. In describing the hand, the term palmar and dorsal surfaces are used instead of anterior and posterior. Similarly, in describing the foot, the plantar and dorsal surfaces are used instead of lower and upper surfaces. The terms proximal and distal describe the relative distances from the roots of the limbs. The arm is proximal to the forearm and the hand is distal to the forearm. The terms superior and inferior means nearer the upper or lower end of the body respectively. Hence the nose is superior to the mouth and inferior to the forehead. Superficial means near the skin surface and deep means farther away from the surface. The terms internal and external are used to describe the relative distance of a structure from the center of an organ or cavity. Ipsilateral and contralateral are used for parts on the same side or not of the body. Hence, left hand and left foot are ipsilateral, while the left biceps brachii muscle and the right rectus femoris muscle are contralateral. The supine position of the body is lying on the back and the prone position is lying face downward.